Welcome back to Seriously Funny. I am your host, Mashnor Kabir, and I pour my cereal before my milk. Today, I have zero script whatsoever, but I've spent the past week looking into a bunch of different mental disorders / illnesses, whatever one may call it. I wonder, an illness is a malfunction, a disorder is something that prevents you from functioning. Anyways, all of these disorders, specific disorders at least, or specific groups of disorders, will probably have their own episode. For example, depressive disorders. I understand those a lot more just because I've talked to a lot more people that suffer from that. And so I have a lot more research and understanding behind depressive disorders. So I may skim over those a little more because at one point they're going to have their own episodes. But for now, I want to offer a disclaimer. Anything that you hear here is not to be used as a self-diagnosis. If you believe that you have certain symptoms of any of these things and they impair you or they do cause you problems in life, please go see either your general care physician, please go see a general care physician or a psychiatrist for a diagnosis. For a lot of these, at least, these are proper disorders. And if you have a therapist, you can also talk to them about it, and they will probably also refer you to someone in order to get a diagnostic if they believe that would help you. So please go seek medical assistance if anything within this podcast episode resonates with you and you think, that's me. Sometimes there's actually an effect where medical students, when they begin med school, a lot of them think they have like every illness possible, because when you read all of these illnesses, you think, oh, I match with all of these. I have this illness. I'm going to die. It's kind of like going to Google because your finger hurts and then you think that you have cancer. That's actually not how life works. Your body is not that frail and fragile, and you probably do not have cancer. So looking these up and researching things online that have to do with your health and symptoms, it's a really challenging thing to do. And a lot of people scare themselves, screw themselves over by doing that. I understand all of these psychological effects of doing these things, and I'm very so first of all, I don't Google my symptoms. I think that's just a bad idea. Go talk to a doctor. Don't Google your symptoms. It's just not a good idea. Other than that, I'm very aware of these things, and I can research these things, and I know I don't have psychotic disorders or PTSD. And remember, we're human, and so the way our body reacts to things, at the end of the day, we're all the same species. You will have symptoms of certain things, and it won't actually manifest or anything. It's fine. And so first, let's define a disorder. Also, I have no sort of notes or script here whatsoever. I'm just going to be reading off all the research I did. And also, most of the information here today will come from the National Institute of Mental Health, which will be a lot of American statistics, a little bit from the World Health Organization, a lot from the DSM-5, which is the diagnostic manual. What does the S stand for? I don't remember. Anyways, the diagnostic manual for mental disorders, and that's the United States thing. That's a national thing here. And then some from the ISM, I think, 11 and 10, which are more international diagnostic books. Then there's a lot of information from the American Psychiatric Association, the American Psychological Association, the Anxiety and Depression Association of America. So, and a lot of them are also from research papers, and not much, if anything at all, is uncorroborated or corroborated by some sort of very official or very scientifically tested thing. I didn't just go to WebMD and find this information. This is well researched, and I put a lot of hours and time into making sure that this information is accurate. There's a lot of books that I've read over the years as well that helps make sure that the things on here are accurate and up to date. So let's start first with defining what a mental disorder is, or what a disorder is in general. Disorder is classified condition that affects your thinking, your feeling, mood, and or behavior to the point of affecting your day-to-day function. So if you cannot go to work because of something, if you cannot function properly, if you can't eat properly because of something, if you're unable to perform well in certain tasks and your life is becoming seriously disrupted, then it's a disorder. Something is seriously messed up. Everyone has some sort of, not everyone, most people have some sort of symptoms of all of these things, but they're not to the point where your entire life is falling apart. And that's when you have a serious, like medically needs to be treated problem. Other than that, therapy usually does. But yeah, an illness is a malfunction within the body, meaning that your body is doing something or reacting in a way that it should not be. And this is usually in response to a virus or a bacteria coming into the body. And then there's depression that is curious, and there's a lot of research behind that and what it may be, but that's probably going to be another episode. Anyways, this episode may be really, really long, so if you're here to learn about all of these mental illnesses, depending on what you want to learn about, I'm going to leave timestamps for the categories of disorders. So there's mood disorders, there's anxiety disorders, there's psychotic disorders, there's personality disorders, there's post-traumatic stress disorder, and there's eating disorders. Along with that, one thing I don't mention here is addiction. So addiction has recently been classified as a mental illness, and whether you believe that whether you believe that mental illness, I think video game addiction got classified recently. Addiction might have been a little bit longer, not as recent. But yeah, whether you believe that addiction is the fault of the brain or the fault of the person who started doing whatever they were doing, addiction can be the use of any sort of vice, drugs, alcohol, video games, anything else that affects your day-to-day functions, missing school or work, not spending enough time with others. If you have a video game addiction, playing video games with someone, or being a drug addict and being high when you talk to people would probably also be disruptive. I'm not sure what it says on that. Addiction can also be treated through services like AA or NA, which is Alcoholics Anonymous, or Narcotics Anonymous. I think there's a lot of video game services out there nowadays. If not, go to like Healthy Gamer Coaching or something. Therapy, detox, rehabilitation. Addiction is a painful and horrendous illness, and it's really just not a fun thing to go through in life. So if you do think you have illness, I don't mention it here because I didn't know what category it would go under, but please seek medical assistance. It's not easy to kick off on your own and can even be dangerous to get rid of on your own. So please go seek help professionally if you believe that you have some sort of addiction. Now, we're going to start with mood disorders. Do I have any other disclaimers or things to say? Not sure. I think we're going to cover personality disorders last. I think that's the only thing I need to clear up. Other than that, yeah, a lot of timestamps at the bottom, whatever you're watching this on, within the description of this podcast, I will hopefully have timestamps for all the 6 categories that I listed above. And also, I'm going to include some sort of treatments here, but again, these treatments are very broad and need to be specified more with the doctor or psychiatrist. So if you believe that you need some sort of treatment, make sure you talk to them, because I'm not going to sit here and say what you exactly need. So we're going to start with depressive disorder. And so this affects about 17.3 million adults in the U.S., which is about 7.1% of the U.S. population. And so some of the symptoms of depression are a depressed mood. I know it's weird to define an illness by the illness, but I think everyone understands what a depressed mood looks like. Significant weight or appetite loss or gain, excess of sleep or a dearth of sleep. Dearth means a lack of. I had to find a synonym. It was a pretty cool word. So there you go. There's a fun vocab word for you. Anhedonia, which is just not finding pleasure in life experiences the same way as you did, or just finding pleasure at all. So anhedonia is just the lack of finding pleasure in life experiences. So things that used to make you feel joy don't do that anymore. Feelings of lethargy, worthlessness, fatigue, and or difficulty concentrating, feelings of hopelessness and or helplessness, and recurrent thoughts of death or suicide. And so within depressive disorders, so those are just symptoms of depression for the ones that we're going to list here. So within depressive disorders, there's a few different sorts of diagnosable depressive disorders. There's MDD, which is major depressive disorder, and this requires at least 5 signs for a period of over 2 weeks of the symptoms we just listed up above. That's from the DSM-5. So MDD is clinically diagnosable and often characterized as a malfunction, an illness that makes your body do something that it's not naturally meant to be doing. Depressive malfunction is displayed by neurotransmitter imbalances that occur in a life that doesn't seem to have any overt grievance points. So meaning to have MDD or clinical depression, you would have to be sad and showing these symptoms that I just mentioned above, but your life doesn't have anything where that should be happening. So if your life is fine and you're not extraordinarily suffering from some sort of other illness, if your life isn't going garbage and you have friends and you have a job and like your life seems like it should be okay, and then you're feeling these symptoms that were listed above, then you have a clinically diagnosable depression here at MDD. And so clinical depression is also often it's episodic, and so it only happens really strongly for a bit and then it gets better and goes away. It's kind of like a sine wave if you know geometry. So it kind of goes up for a while and it's there, and then you go to a psychiatrist, they help you out for a bit, and then it goes away, and then it might come back later. It might not. Also, I mean, predicting these things is really hard. We only understand so much about the brain, psychology, and all of these disorders. It's complicated. Some sort of treatments for this can be therapy, of course, which is really effective, antidepressants, which can be effective, and so I also have listed for a lot of these meditation. It is a treatment that you can do, which is basically just going to be self-done treatment. However, I also put in parentheses here. So I'm going to link my Notion page that has all of this on it, like everything I'm reading to you. So if you want to go read that all instead or follow along, please do that. That's going to be at the top of the description as well. Anyways, meditation is not recommended because most people they don't have the ability to fix something themselves, especially a mental disorder. Fixing your functioning in life and having the self-awareness and insight, which is I think that's a medical terminology, which is just understanding like what's going on with you. And we'll probably see that more in psychotic disorders. But yeah, meditation is obviously something you should do, and it's something I talk about a lot on this podcast. However, don't solely use meditation to solve your mental disorders. Although, yes, there is proof that they can. Don't do that by yourself. Do it in tandem with, again, seeking medical professional help. I'm going to say that a lot. We don't want people to self-diagnose. I don't enjoy or like hearing people self-diagnose themselves. All right, the next depressive disorder is dysthymia, and this is either persistent depressive disorder, unipolar depressive disorder, or chronic depressive disorders. Has quite a few names. And so this also requires at least 5 signs for a period of over 2 months rather than 2 weeks. And this one is there's a lot of names for this one. The symptoms for this one is the same symptoms of depressive disorder, but for a longer time and more mild than the episodic lows of the MDD that we just mentioned. So they last for a longer time and are more chronic. So similar to MDD, it's going to be the same, but you won't feel as bad and the symptoms won't be as bad, but they'll just last for a longer time and they'll stick around longer. And so the treatment for these, same as the MDD, therapy, ADs, go seek the professional help and get into some sort of meditation while you do that too. The next, actually I'm going to mention this one next. So Post-Partum depression or perinatal depression. So this is MDD symptoms present during or after the delivery of childbirth. And so this happens due to hormones that get heavily shuffled during or after pregnancy. This makes sense. You got to understand. So yeah, a lot of depression is just a matter of neurochemical imbalance. And so that's the reason that when your life is going okay, why are you depressed? Like, why does that happen? There's certain things and chemicals going on in your brain that just aren't doing you the greatest. There's also some other theories, and maybe we'll touch on that just a bit. But again, I want to give depressive disorder its own episode one day. Next is seasonal affective disorder, the big SAD. SAD is the acronym for this. So yeah, some people call it the big SAD. It's really good. And so SAD occurs when depression symptoms become present during certain seasons, typically starting in the late fall and early winter and fading during the spring and the summer. So SAD is usually thought to occur due to a lack of sunlight, and sunlight as well as normal light, so just like white light, it has been shown to affect mood and cognitive function. So the treatment for seasonal affective disorder is light therapy. And so the next depressive disorder that I want to mention isn't actually a diagnosable clinical disorder. Like, you can't be clinically diagnosed with this. You're not going to see this anywhere. It doesn't exist. So I got it from a psychiatrist from Harvard. So it's congruent depression. So there's no statistics for congruent depression because it's not a diagnosable illness. But so congruent depression is going to be people that are paralyzed by loneliness. They feel like their life is on autopilot. So like you're kind of dissociated. You're like watching your life happen in front of you, and then feelings of falling behind in life. So these are, for these people that have congruent depression, this is most people that probably get diagnosed with clinical depression. At least I would think so. So symptoms of MDD and symptoms of depression may be present, the loneliness, the feelings of death, the lethargy, the lack of the anhedonia, all of that may be present. However, it's often really long lasting, like more than the chronic depressive disorder we mentioned earlier. Like this is going to be lasting for years, and this is characterized by a high lack of self-purpose and motivation. However, this person's life is often going wrong. So like we said earlier with MDD, it's clinical depression because it doesn't seem like there's a reason for you to be depressed. It's a malfunction. You shouldn't be depressed, but you are. And so like there's a mistake. For congruent depression, if your life is going absolutely garbage and you're depressed, like there's a good reason for that. If you just went through something traumatic, it's normal for you to feel bad. If someone dies or your pet dies, you feel bad, and that's not something that's going wrong. That's normal. That's supposed to happen. And so congruent depression is literally just a response to your life being garbage. If you think it's garbage, perspective is really weird. But yeah, so this depression is congruent to your situation, meaning it's the same. So the more garbage your life is, the more this like sense of depression is. And so again, this isn't clinically diagnosable and isn't clinical depression. And so it's not gonna probably be a neurochemical imbalance exactly. It's not really a malfunction. It's just an appropriate response. And the way to deal with it is really just doing your best to live your life, and then therapy and is going to be your best move here. Psychiatry and antidepressants may help, I don't know. But for this one, I mean, I can only really recommend psychotherapy, which is talk therapy, so like sitting with a therapist and talking about your life and feelings, or seeing a psychiatrist, again, since this isn't a diagnosable disorder. If I were to give you personal, non-medical advice, just go do things in your life and find a solid support system in your life. The loneliness and just doing nothing, and these are people that are prone to, quote, addiction, end quote. A lot of, quote, video game addicts, end quote, are really just, they have congruent depression. Like they don't feel like their life is worth anything. They don't feel like their life has purpose. And so then they sit all day and they play games because like it gives your brain stuff that you enjoy. And so risk factors for depressive disorders include family history of depression. So depression has really been very fairly linked to genetics. So if someone in your family has been depressed or has depression, there's a fair likelihood that, that's where it came from. Trauma or chronic stress can be a risk factor for depression. Social isolation is going to be a very fair risk factor for depression, and so a lack of sunlight and light. And so depending on the color in your skin, meaning the amount of concentration of melanin in your skin, the amount of sunlight you need will be differing from person to person, but sunlight is really important in order to keep you less depressed. And so keep your windows open, moral of the story. And also, the lighter your skin is, so the more fair your skin is or the whiter you are, the more sunlight you need pointed towards you to make sure that you have enough vitamin D and enough sunlight. Pre-existing illnesses can cause some sort of depression. I think this goes more with congruent depression, but I mean, you're going to feel really bad if you're sick. That makes sense. Unhealthy diets and unhealthy sleep schedules, these things mess with your neurotransmitters and your chemicals, so that's going to cause you some problems. And it also has been shown that a lower socioeconomic status has a higher likelihood or possibility of being depressed. And so for other thoughts with depression, I included some other thoughts, which are kind of just like things that I understand and know about the illness that I couldn't find research on. So this is to be taken with grains of salt. For depression, it's a really complex illness, but there's evidence that shows that it might not exactly be a malfunction. Rather, it might be something that Mother Nature kept around. Like I said, there's a lot of connection to genes here and to genetically passing it on. And Mother Nature gets rid of things that it doesn't need. So why are we still passing this gene on? It should be gone. But there might be a reason for that. And I think we're going to delve deeper into that because it's really interesting. Another day on its own thing. So yeah. The next mood disorder is bipolar disorder. So this is formerly known as manic depression, and it's been renamed to bipolar disorder in the DSM-5. That's what you're going to find it called as. And so this bipolar disorder is characterized by the vacillation or the switching of unpredictably of hopelessness and lethargy, of depression, and the overexcited state of mania. And manic symptoms include abnormally upbeat, increased activity, energy, or agitation, jumpy, exaggerated sense of well-being and self-confidence or euphoria, racing thoughts, increased distractibility. There's also hypomania, which is a less severe and less detrimental to normal life. So it's a lesser version of the manic symptoms given here. So there's 3 types of bipolar disorder. There's bipolar 1 disorder, which is going to be manic episodes lasting at least 7 days or severe mania necessitating immediate hospital care. Depressive episodes also present, lasting around 2 weeks. And the depressive episodes have both depressive and manic symptoms. So bipolar 1 disorder is a highly affective disorder, so it really F's people's lives up pretty often, especially with your social relationships, because it gets really hard for people that are in relationships with people with bipolar to handle that and have the patience to handle that. And a lot of the treatments are actually for the people that are around those with the mental illnesses. So a lot of treatments, if you look into them yourself, I didn't include them much here, but they're going to be information sessions for the families and loved ones of those with certain disorders, so they can understand how to handle and take care of people with these disorders. Because some of the disorders, especially the psychotic and PTSD, those are hard to deal with, especially if you're a person in the person who's ill's life. It's really hard to say that in words. In writing, it's easier. Anyways, yeah, so these mood bumps are longer term rather than something that's just capricious. So someone that just gets angry really quickly randomly just for something dumb you said, they're probably got something else going on. But yeah, bipolar 1 disorder is a long-term illness that is medically speaking, quote, incurable, end quote, but manageable. I don't personally believe that. I don't believe that any schizophrenia, psychotic disorder, those get a little different, and personality disorders also get really complicated. I don't think that most mental disorders are incurable. That's just, I don't agree with that. There's a lot of people I'm sure that can say, yeah, I had diagnosable bipolar disorder and now I have nothing for the past however many years of my life. I'm fine. But I don't personally believe that most of these or a lot of these disorders are incurable. They definitely are very treatable and if you put in the work, can be completely vanished just due to self-awareness and how the brain works. Anyways, treatment for bipolar 1 disorder is going to be psychotherapy, which is talk therapy, ADs, which are antidepressants. I'm going to be referring to them as ADs. And again, meditation, again, very challenging to do alone, but the meditation is going to help through self-awareness. And so for bipolar 2 disorder, which is the next bipolar disorder, these are depressive and hypomanic episodes, but not as manic or not as extreme as bipolar 1 disorder. So bipolar 2 is just a less affective disorder than bipolar 1, meaning that it's less effective, meaning that it impacts your life less. And so the treatment for bipolar 2 disorder is going to be similar: psychotherapy, ADs, and meditation. And then there's cyclothymic disorder. Am I pronouncing that correctly? Cyclothymic, yep, or cyclothymia, which are periods of hypomanic symptoms as well as periods of depressive symptoms lasting for at least 2 years, but the symptoms do not meet the diagnostic requirements for a hypomanic episode and a depressive episode. So this is the least effective version of bipolar disorder, but it can be present at younger ages. So again, similar to the prior two, psychotherapies, ADs, and meditation. For younger people, that's probably going to be harder to do because it takes discipline. Risk factors for bipolar disorders are genetics, so a lot of these are going to be genetically passed on. Brain structure and functioning. I'm not sure if this is because of the disorder, so different brain structures have been attributed to bipolar disorder. So I don't know if bipolar disorder causes those differences, or if those differences were pre-existing and that caused a bipolar disorder. You know what I'm saying? So, I got that from the NIH, so National Institute of Mental Health, NIMH, sorry. And yeah, I don't know. That risk factor seems a little more iffy and arguable to me. But yeah, bipolar is a really challenging disorder that switches people between extreme moods. There are times though that people are in a normal, average state of mind, and the people around with bipolar, especially those that are significant others of those with bipolar, it takes a lot of patience to handle. And so yeah, those are mood disorders. So yeah, this is going to be a fairly long episode, especially when we get to personality disorders. Yeah, let's move on to anxiety disorders. All right, we got three sorts of or categories here: anxiety disorders, panic disorder, and OCD, obsessive compulsive disorder. And so for anxiety disorders, we have, so if you look at my Notion page, I include the neurochemicals that are very likely involved with the disorders, as well as the areas of the brain involved. I'm not going to list them here because I'd also have to explain what they are and what their functions are, and I need to do more research on that myself. So yeah, go look at the Notion page again in the description. So anxiety disorder, anxiety is caused by the locus coeruleus. Oh, so I just mentioned a brain part, maybe I lied. Anyways, so that is an area in the brain or the body that puts fight or flights into the spine and the brain, and this happens in order to prepare the body for a dangerous situation, and that response of putting fight or flights into the brain is called an analgesic response. And so anxiety disorders are the most common mental illness in the United States. So this is 18.1% of adults in the United States. That's the U.S. So if you're international, I don't know what the numbers are internationally. I think the World Health Organization has some statistics for that. Anyways, first there's generalized anxiety disorder, or GAD. So this is characterized by excessive anxiety or worries, feeling restless, wound up, or on edge, difficulty concentrating, or your mind is blanking out, irritability, muscle tension, difficulty controlling feelings of worry, and issues with sleep, whether that be hypersomnia or insomnia or restlessness. Hypersomnia meaning that that you sleep too much. Generalized anxiety disorder is a common illness, and it is very, very treatable. It's an illness that people with a lot of catastrophizing and thinking that things will go wrong, and those thoughts sometimes lead to thoughts of dying. However, it's different from depressive disorder. It's a fear of dying rather than a will or a coveting of death. So people with depressive disorder will think more of doing death, like taking part in it, suicide. And people with anxiety will think of death as something that's going to happen because they're worried about it. So that makes sense. Fight or flight chemicals are shot when you're afraid of things, when your body and your mind is like, all right, we can't die right now. We're going to shoot these in the brain, and hopefully you react well. And so, it's a malfunction there. So yeah, it's a fear of death. That said, GAD can lead to depression. But, that's weird because they're kind of opposite, but then they can go together. A lot of people have anxiety disorders with depressive symptoms. That's not uncommon to my understanding. But yeah, it's really often attributed and made fun of as overthinking, GAD, and it can cause people to stop functioning in society out of fear of bad things happening, which can cause a paralyzing effect and cause panic attacks. So that's going to be the panic disorders we mentioned in a bit. But yeah, so anxiety it's been linked to a lot of physical things. So a lot of physical illnesses, such as functional abdominal pain syndrome, or FAPS, yeah, great acronym there, has been linked to anxiety problems or stress problems, increase in asthma symptoms due to anxiety. So yeah, this is going to be seen a lot more if you study the field of psychoneuroimmunology. Yeah, it's a long, big old name there. But yeah, so people with thicker ventral medial prefrontal cortexes are less likely to have anxiety problems. I don't know what part of the brain that is exactly, but there's a fact for you. Yeah, so treatments for anxiety, it's a highly treatable disorder. So that means this is you can literally cure this. Like, you can rewire your brain to a point where this doesn't affect you. Cognitive behavioral therapy, which is going to be referred to as CBT for the rest of this episode. So yeah, CBT can rewire the brain and cure GAD, and also meditation, which also can rewire the brain. But again, don't do these things alone. You're not playing a single player game, get professional help. The next anxiety disorder is going to be social anxiety disorder, and these are similar to the symptoms of generalized anxiety disorder, but it's centered around social situations rather than any sort of life situations. So this is going to be intense fear towards social situations, and this will manifest in people when they're interacting with others. They're going to be imagining that other people are over analyzing their mistakes, possibly heavily judging them. And social anxiety is also often accompanied by agoraphobia, which is shown by intense fear of two or more of the following situations: being using public transportation, being in open spaces, being in enclosed spaces, standing in line or being in a crowd, and being outside of home alone. So yeah, this can all come together and cripple someone's life completely to the point of being unable to go outside of their house or partake in necessary actions to be a part of society. Social anxiety disorder is not good for people, but it seems like it's becoming really common because everyone loves to say I have social anxiety. Treatments for this are going to be similar to anxiety: CBT therapy, meditation, and also exposure therapy for the agoraphobia. Risk factors for anxiety disorders are going to be temperamental traits of shyness or behavioral inhibition in childhood, exposure to stressful and negative life or environmental events in early childhood or adulthood, and a history of anxiety or other mental illnesses in biological relatives, so again, passed through family, and then some physical health conditions such as thyroid problems or heart arrhythmias, or caffeine or other substances or medications can produce or aggravate anxiety symptoms. So caffeine has been shown to very negatively affect anxiety. So if you have anxiety problems, don't drink coffee too much. It's not going to help you at all. A physical health examination is helpful in the evaluation of a possible anxiety disorder. I know thyroid issues can also really affect depression, and it can cause a lot of depression as well, because thyroid is a problem where your hormones are just dying. Other thoughts. Anxiety disorder is a lot harder for me, so I'm not gonna mention these. But yeah, again, go give them all a read on the Notion linked below once more. Next is going to be panic disorder. So panic disorder is going to be characterized by recurrent, sometimes unexpected panic attacks, which is identified by the following: heart palpitations, pounding heartbeat or an accelerated heart rate, sweating, chills or heat sensations, trembling or shaking, dizziness, depersonalization, meaning that you can basically like see your body or like your life, you're just like kind of watching yourself have a panic attack. Like you're like, what is happening? Shortness of breath or sensations of smothering or choking, intense feelings of fear, feelings of being out of control, feelings of impending doom. Panic disorder often accompanies anxiety disorder, from my understanding. It's not exactly panic disorder. Anxiety is often accompanied by panic attacks. Again, to my understanding, couldn't find empirical data. Treatment for panic disorders are going to be therapy, CBT, again. Why did I write CBT therapy? Meditation, once more. Being able to notice and engage in meditations as the panic attack begins. It's really, really hard to do that, but if you can do that, you can stop a panic attack before it becomes really serious. Risk factors are going to be family history of panic attacks, major life stress, major life changes, smoking or excessive caffeine intake, and prior mental health disorders, especially anxiety or depression. And so other thoughts for panic disorder. From my personal understanding, there's also what people would call an emotional breakdown or a nervous breakdown. So this is going to occur in times of great stress or high emotions, especially of anger or sadness. And although there aren't as many physical symptoms or feelings of doom, however, it causes weakness in the muscles to the point where you are rendered unable to move. And so that's my understanding of a mental or emotional or nervous breakdown rather than a panic attack or a panic disorder. Those also happen to people. That's not fun. Your body just absolutely just paralyzed, and it's not a good time. Anyways, the next anxiety disorder is obsessive compulsive disorder. Everyone knows this, and everyone loves to say, I like all of my pencils to be in the correct color order, and I have OCD. You probably don't. OCD. So I know someone who, or I have known someone that actually has had OCD. After I talked to that person about their, life and the things they go through, I'm not a fan of people going around saying I have OCD. No, you really don't. It really, really, really sucks. Like, it's a horrible, horrible disorder, and we're gonna see that here. So OCD is gonna be a chronic, long-lasting disorder that's characterized by an uncontrollable, reoccurring thoughts. These are obsessions and/or behaviors. These are compulsions that someone feels the urge to repeat over and over. Obsessions are repeated thoughts, urges, or mental images that cause anxiety. The symptoms include fear of germs or contamination, unwanted or taboo thoughts involving intercourse, religion, or harm, aggressive thoughts toward the self or others, having things symmetrical or in perfect order. Compulsions are repetitive behaviors that a person with OCD feels the urge to do in response to an obsessive thought. Although there are a wide range of compulsions, some common examples are excessive cleaning and or hand washing, ordering and arranging things in a particular precise way, repeatedly checking on things, such as repeatedly checking to see if the door is locked or that the oven is off, compulsive counting. And so not every ritual or habit is a compulsion. We all have our rituals, we all have our habits, we all have things that we like to do. Brush your teeth and go to bed, like that's one. Wake up in the morning and eat breakfast, that's another. Like, these aren't going to be a compulsion. Everyone double checks things, but people with OCD generally exhibit these extra traits. They can't control thoughts or behaviors, even when those thoughts or behaviors are recognized by the person to be excessive. So this is the concept of insight that I mentioned a little bit ago. Insight is understanding that what you're doing is absolutely insane and crazy. So a lot of people with OCD, even though when their body says like, hey, you have to put the left foot in front of before the right foot when you're walking up the stairs or else you're going to die, although someone with OCD understands that's absolutely ludicrous and dumb, they have to do it. Like, they just have to do it. But yeah, and these people, OCD people, spend at least 1 hour a day, on all of these thoughts or behaviors. They don't get pleasure when performing these behaviors or rituals, rather a feeling of relief from anxiety that the obsessions and compulsions cause. So when I do my rituals of like saying brushing and going to bed, or brushing, reading, and then going to bed, like, I feel dope. Like, it's fun. There's a feeling of pleasure from that. But for other people that feel like they are compelled to do it, they wouldn't feel pleasure. It would just be something they have to do, and they just save themselves from dying. Not fun. Anyways, also experiencing significant problems in their daily life due to these thoughts or behaviors, and that's what makes this a disorder. Along with this, some people with OCD have a tic disorder, which are sudden, brief, repetitive movements such as eye blinking and other eye movements, shrugging, tapping, etc. Again, after having spoken to people with OCD and listening to people with OCD, it's really, really bad. It's not a fun. It has traits from both GAD and PD, or panic disorder, and yeah, these obsessions cause anxiety. It's not a fun time at all. So treatment for this is going to be psychotherapy and medication, psychotherapy and medication. And so now there's also OCPD. Now, OCPD is actually a cluster 3 personality disorder, which we're going to get to at the end. Maybe we won't. Maybe I'll just cut that out and make it its own thing later, because I feel like I'm going to hit an hour, and we might be overdoing it today. But yeah, OCPD, or obsessive compulsive personality disorder, it has similar. I put it here because it just fits so well. I didn't want to go move it to the personality disorders. Again, it's a cluster C personality disorder. Yeah, cluster C personality disorders are characterized by anxious and avoidant tendencies and behaviors. Anyways, OCPD symptoms are similar to OCD symptoms. However, people with OCPD, so obsessive compulsive personality disorder, are unaware, so they have no insight to the fact that their thoughts and behaviors are, for lack of better terms, crazy or ludicrous. People with OCPD believe that what they're doing is correct and that it should be done, rather than people with OCD who are like, I know this is dumb, but I have to. People with OCPD think this isn't dumb. This like I have to do this and it's correct. But yeah, it's very similar to OCD, which is again why it's here instead of in the personality disorder section. Treatment is going to be medication and psychotherapy. And so the last OCD disorder, obsessive compulsive disorder, is going to be body dysmorphic disorder, BDD. So this actually doesn't go under the eating disorders, which we will touch on right after this. BDD is characterized under obsessive compulsive disorders in the DSM-5. Those with BDD obsess, which we talked about earlier, what an obsession is, obsess about their body. They are unable to control their negative thoughts and don't believe when people contradict those thoughts. So if someone believes that they're fat when they're not, and you say, no, you're not, like they say you're stupid. Yeah, the thoughts of BDD may cause severe emotional distress and interfere with daily functioning. People with BDD have persistent and intrusive preoccupations with an imagined or slight defect in one's appearance. The defects that people with BDD dislike about themselves can be any part of the body, but the perceived defect in reality may only be a slight imperfection or be non-existent. But to someone with BDD, the imperfection is significant and prominent. So yeah, BDD is a disorder that causes people to obsess over imperfections or see imperfections in themselves that may not even exist. These people will often experience anxiety due to their compulsions, and BDD is often going to be attached to eating disorders, which we're going to get into right around in a few seconds here, or in a moment here. So yeah, risk factors for obsessive compulsive disorders include genetics, childhood trauma, and neurochemical imbalances. Yeah, OCD sucks. That's the moral of the OCD story. Moving on to eating disorders. All right, yeah, eating disorders are characterized by an unhealthy preoccupation with eating, orthorexia, there we go, too much exercise, and or body shape. Eating disorders are often attached to the obsessive compulsive disorder, BDD. For more information, go look at the anxiety disorders that we just mentioned. Yeah, these disorders are highly dangerous and very fatal. First, there's BED and OSFED. So this is going to be binge eating disorder, which is going to be BED. This is 1.2% of the U.S. population. So BED is characterized by a loss of control over one's eating. Unlike bulimia, which we'll touch on in a bit, periods of binge eating are not followed by purging, use of laxatives, or orthorexia. That's a hard word, man. Orthorexia or fasting. So these people will like binge eat food, but they won't like do something to make it all go away. People with BED are often overweight or obese. BED is the most common eating disorder in the United States, and it has the following symptoms: eating unusually large amounts of food in a specific amount of time, such as a 2-hour period, eating even when you're full or not hungry, eating fast during binge episodes, eating until you're uncomfortably full, eating alone or in secret to avoid embarrassment, feeling distressed, ashamed, or guilty about your eating, frequent dieting, possibly without weight loss. BED is a treatable disorder, and although it's not as fatal as some of the other ones we're going to mention here, it should be taken care of, and the treatments are going to include CBT, psychotherapy, group therapy, medication, preferably in tandem with therapy, and nutrition counseling. Next is going to be OSFED, or other specified feeding and eating disorders. So this, again, similar to congruent depression, isn't diagnosable. These people have multiple symptoms of other eating disorders listed here, or that we're going to talk about in a second. However, they don't align with any specific disorder. Many people seeking treatment for eating disorders have OSFED here. So yeah, not diagnosable, but treatment-wise, I can only really recommend psychotherapy or seeing a psychiatrist, since this isn't diagnosable, and they'll take you through what you should do. So risk factors include adverse childhood experiences, trauma and bullying, parental depression, vulnerability to obesity, repeated exposure to comments on weight, shape, and eating, so bullying due to your weight, and a history of BDD or body dysmorphic disorder, which we talked about a second ago. Other thoughts here are, so there's also RFID or ARFID, which is avoidant / restrictive food intake disorder. And this disorder is one that develops earlier in life for a lot of people, where people avoid or restrict their food intake to a point where they don't get enough nutrients or calories. I didn't give it its own section because I couldn't find enough information about it from the NIMH, National Institute of Mental Health, once more. And so next is going to be anorexia nervosa. 0.6% of the U.S. adult population. People with anorexia may view themselves as overweight, although in reality they are dangerously underweight. These people weigh themselves repeatedly, severely restrict the amount of food they eat, often exercise excessively and/or force themselves to vomit or use laxatives to lose weight. Anorexic people have the highest anorexia has the highest mortality rate of any mental disorder through either starvation or suicide. Symptoms for anorexia nervosa include extremely restricted eating, emaciation, meaning you're unhealthily thin, relentless pursuit of thinness and unwillingness to maintain a normal or healthy weight, intense fear of gaining weight, distorted body image, possibly BDD, self-esteem that is heavily influenced by perceptions of body weight and shape, or denial of emaciation. So saying that, no, I'm not thin, or I'm not unhealthily malnourished. Other symptoms may develop over time. So the thinning or weakening of bones, which is osteopenia or osteoporosis, mild anemia and muscle wasting and weakness, brittle hair and nails, dry and yellowish skin, growth of fine hair all over the body, severe constipation, low blood pressure, slow breathing, lower pulse, damage to the structure and function of the heart, brain damage, multi-organ failure, drop in an internal body temperature causing the person to feel a persistent coldness, lethargy, sluggishness, or feeling tired all the time, and infertility. As you can see from that really, really long list of symptoms, it's not hard to see why this is the most fatal mental illness that we so far have. Really dangerous, really bad. People with disorders should seek help as soon as possible. If you think you have any symptoms here that may be problematic, please go see a doctor. This one's really bad, as you just saw. It really, really, really bad. Your diet as a human being is really, really important for so many different aspects of your life. So please make sure that you're taking care of yourself in that area, especially. So treatment for anorexia can include group therapy, CBT, medication, and nutrition counseling. I'm not going to put meditation here. I didn't put meditation here. This is way too serious for something that you should even attempt. You need professional help. If you know or yourself have any sort of anorexia nervosa. Next is bulimia nervosa. So this is 0.3% of the U.S. adult population. That's 18 and above. Bulimia is characterized by frequent recurring episodes of eating unusually large amounts of food. This is often called binging. You can see that in the BED we mentioned earlier, followed by a behavior that compensates for the binging, or this is called purging pretty often. This involves one or more of the following: laxatives, diuretics, fasting, orthorexia, or a combination of these behaviors. People with bulimia nervosa may slightly be underweight, normal weight, or overweight. They could be anywhere on that spectrum. Symptoms for bulimia include chronically inflamed and sore throat, swollen salivary glands in the neck and the jaw area, worn tooth enamel, and increasingly sensitive and decaying teeth as a result of exposure to stomach acid if you're throwing up a lot, acid reflux disorder, and other gastrointestinal problems, intestinal distress, and irritation from laxative abuse. That's going to be the organs and stuff going on near your stomach area, and severe dehydration from purging of fluids, and also an electrolyte imbalance. So that can be too high or too low levels of either sodium, calcium, potassium, and other minerals, and this can lead to a stroke or a heart attack. This disorder is often hard to catch in some people because, again, they could be normal weight. You might not know, but it's dangerous and it should be treated. Similar to anorexia, it's not fun. Treatment is going to include nutrition counseling, psychotherapy, CBT, and medications, preferably in tandem with psychotherapy. In tandem meaning at the same time. Risk factors for bulimia and anorexia are going to be genetics, history of weight concern, negative caloric imbalance, meaning that you burn more calories than you take in, type 1 diabetes, trauma, bullying, unhealthy social stigmas, or cultural ideals. So if you're in a culture where you need to be a certain like weight, and your body just isn't meant for that, that could cause problems. History of BDD or anxiety can also be a risk factor. These eating disorders are not fun, and I know people that suffer from these. It's just really bad and really, really effective for people, meaning that it really causes issues for some people. So yeah, seeing that we're going to hit so much time, we're going to really quickly cover PTSD and then psychotic disorders, and then we will wrap it up and not do personality, because personality disorders are really, really long and really, really complicated. So yeah, I can give that its own episode in 2-3 weeks. I'll see how this one does, I think. Anyway, so yeah, PTSD, post-traumatic stress disorder. We've all probably heard of this one. So this is 3.6% of the US adult population. And this disorder develops in some people that have experienced a shocking, scary, or dangerous event in which past traumas cause people to feel stress or have an analgesic response when they are not in danger. If you analgesic response, we talked about that in the anxiety disorders. So the symptoms that must be present for at least 1 month and severe enough to interfere with relationships or daily functioning, that's going to be considered PTSD. So some people recover within half a year, others, the symptoms last longer. The symptoms required to be diagnosed with PTSD must hit all of the following for at least 1 month. At least one re-experiencing symptom, at least one avoidant symptom, at least 2 arousal and reactivity symptoms, at least 2 cognitive and mood symptoms, and we'll talk about what these are. So re-experiencing symptoms are flashbacks or reliving a trauma over and over, including physical symptoms like a racing heart or sweating, bad dreams or nightmares, or frightening thoughts. Avoidant symptoms, things that remind a person of the traumatic event and can trigger these symptoms, which cause a person to change his or her personal routine in the following ways: staying away from places, events, or objects that are reminders of the traumatic experience, avoiding thoughts or feelings related to the traumatic event, and then next are arousal and reactivity symptoms. These are constant symptoms that cause a person to feel stressed and angry and will disrupt daily tasks, sleeping, eating, or concentrating. Being easily startled, feeling tense or on edge, having difficulty sleeping, and or having angry outbursts. Finally, there's cognitive and mood symptoms. These symptoms can begin or worsen after the traumatic event. They're not due to injury or substance use. So if you're on alcohol or drugs and you have these symptoms, they're not going to count towards your diagnosis. And that goes for, I think, most, if not all of these disorders. So these symptoms may make a person feel alienated or detached from people. Although these symptoms may happen after a shocking event, they must be present for 1 or more months and not due to substances. So these are the following: trouble remembering key features of the traumatic event, negative thoughts about oneself and or the world, distorted feelings like guilt or blame, loss of interest in enjoyable activities, so anhedonia. And so some symptoms for children or younger children, so less than 6 years old, can have the following symptoms: wetting the bed after having learned to use the toilet, forgetting how to or being unable to talk, acting out the scary event during playtime, being unusually clingy with a parent or adult. As for teens, they may develop disruptive, disrespectful, or destructive behaviors. They may feel guilty for not preventing injury or deaths. They may have thoughts of revenge. So yeah, PTSD affects a fair amount of people. PTSD is really hard to catch, according to some psychiatrists, because it has a lot of symptoms, and it's pretty often it can be disguised as other illnesses, and so it'll get misdiagnosed as depression, anxiety, or something else, and people won't be getting better because they got the wrong diagnosis and they're receiving the wrong treatment. So yeah, it's hard to catch sometimes, and it can really be detrimental to someone's life. For treatment, again, make sure you talk to your doctor or mental health care provider. Different people have different steps to receive treatment. This one's complicated. Really not a good time here. It's going to be seeking out support from others: psychotherapy, medication, exposure therapy, and cognitive restructuring. PTSD is really, really complicated. If you want to help yourself to the best of your abilities, exercise, meditation, realistic goal setting, and breaking up large tasks into smaller ones, those can help you. But again, medical treatment, really important. Treatment is pretty readily available, so that's awesome. All right, let's hit the last one. This is going to be psychotic disorders. We're going to hit our longer than 1 hour episode here. It's been a really long time since we've had a long episode. I think the people that are listening to this might be new to this podcast. So if you are, while this page is loading, drop us a follow, a like, a subscribe, whatever you're listening on. Make sure you come here every week, every Friday, for a new episode of Seriously Funny, where we talk about a bunch of great fun stuff here. This isn't great or fun stuff, but if you're here to learn about mental illnesses, either you're interested for the sake of someone else or you're interested for yourself, again, if you have any sort of qualms or thoughts that you may suffer from anything here, please go consult a doctor or a psychiatrist. Yeah. All right, next, psychotic disorders. The page is loaded. Psychotic disorders affect a person's perception and attachment to reality, and symptoms include disorganized speech or incoherent speech, confused thinking, strange, possibly dangerous behavior, slowed or unusual movements, cold, detached manner with the inability to express emotion, mood swings or other mood symptoms such as depression or mania. Here we have psychosis, and we have schizophrenia. Those are going to be the two types of things that go under the psychotic disorders. So psychosis affects lower than 1% of the adults in the United States. So psychosis is a term to characterize conditions that affect the mind where a person loses touch or becomes completely detached from reality. During psychotic episodes, a person's thoughts and perceptions of reality are disturbed, and they may find it challenging to differentiate what is real and what is not real. Warning signs for psychosis include the following: sudden drop in grades or job performance, new trouble thinking clearly or concentrating. So like this hasn't been something that you've struggled with for a while, so just out of nowhere you're having problems with concentration or coherent thought. Suspiciousness, paranoia, and unease around other. Unusual, overly intense new ideas, strange feelings or no feelings at all, decline in self-care and or personal hygiene, difficulty telling fantasy from reality, confused speech or trouble communicating. Symptoms of psychosis include the following: delusions or false beliefs, hallucinations, incoherent or nonsensical speech, behavior inappropriate to the situation at hand, and possible experiences of depression, anxiety, sleep problems, social withdrawal, lethargy, and difficult overall functioning. Psychosis is a disorder that violently disrupts someone's life. Unlike mood disorders and anxiety disorders, psychosis is a highly affective disease that can completely prohibit living on a neurological and physical level. People become delusional, imagine things that aren't present, and become extremely, extremely paranoid. Psychotic illnesses are on a different level in the mental health field because they are just, when you're detached from reality, life is different. Treatment for psychosis will include individual or group psychotherapy, medication, and case management. Risk factors for psychosis are going to include previous mental illnesses, especially schizophrenia or bipolar disorder, a lack of sleep, prior medical conditions, drugs, alcohol, or other mind-altering substances. Go back to the lack of sleep for a second. If you are not sleeping at all for a long amount of time, there are chances that you're going to have psychotic problems. You will see things that are not there. You will become paranoid. You're going to have some issues. Please sleep. It's the easiest thing that you can do for yourself. Anyways, psychosis, it's not fun to deal with. A lot of different versions of psychosis here that I didn't really list. There's like delusional disorder, which is just having delusions. Brief psychotic disorder, which as the name implies, is a short period of psychotic behavior. Shared psychotic disorder, which is really interesting. I saw this. You can basically transfer your delusions to another person that you're in a relationship with. Crazy, dude. Who knew? Humans are pretty contagious. I wrote a blog post a few weeks ago called Contagious or something. Go read that. You're contagious, dude. And if your psychotic freaking passing on doesn't prove it, don't know what will. Yeah. Schizophrenia. We've all probably heard this. This affects like about 1.1% of adults in the US. And so schizophrenia is a mental illness affecting a person's thoughts, feelings, and behaviors. People with schizophrenia show symptoms of losing touch with reality, which often causes significant distress for the individual and the people around them. Schizophrenia will usually be diagnosed after a psychotic episode. Schizophrenic symptoms generally fall into 3 categories: psychotic symptoms, negative symptoms, and cognitive symptoms. Psychotic symptoms include altered perceptions, abnormal thinking, and unnatural behaviors. People with psychotic symptoms lose a shared sense of reality and experience themselves and the world in a distorted way. This includes hallucinations, delusions, disorderly thought, which is unusual thinking or disorganized speech. Negative symptoms include a loss of motivation, disinterest or anhedonia, social withdrawal, difficulty showing emotion, and difficulty functioning normally. So negative symptoms are going to include reduced motivation, difficulty planning, and sustaining activities, beginning and sustaining activities, diminished feelings of pleasure in everyday life, quote, flat affect, end quote, or reduced expression of emotions via facial expression or tone of voice, reduced speaking. Those are negative symptoms. Then there's cognitive symptoms, which include problems in attention, concentration, and memory. For some people, the symptoms of schizophrenia are subtle, or some an increase for others. So cognitive symptoms are going to include difficulty processing information to make decisions, problems using information immediately after learning it, and trouble focusing or paying attention. So schizophrenia, similar to psychosis, is a highly affective disorder. It really affects someone's life. And there are people like John Nash, who is a Nobel Prize winner in physics, I think, and he had schizophrenia. So it is an illness that we don't know enough about, but it's a disease that can cause people to be extremely delusional, believing in things such as them being like Jesus or something. And it's challenging to deal with, but you can live with it. Like I said, someone won a Nobel Prize as a schizophrenic patient, so it happens. So treatment for schizophrenia can include antipsychotic medication, CBT, or other psychosocial treatments, support programs for those close to the person, coordinated specialty care, and assertive community treatment. Then there's schizoaffective disorder. So this is really just going to be schizophrenic symptoms in tandem with a mood disorder, such as depression or bipolar disorder. And so treatment for this is going to be the same as schizophrenic disorder, which is antipsychotic medication, CBT, or other psychosocial treatments, support programs for those close to the person, coordinated specialty care, and assertive community treatment. Risk factors for schizophrenic disorders are going to be genetics, living in poverty, stressful surroundings, exposure to viruses, and nutritional problems before birth. Some ways that you can assist those with schizophrenia, especially if you're close to them, is by not telling them that they're insane, crazy, or that they're wrong. Rather, don't support what they're saying, but acknowledge what they're saying. So, yeah. Complicated. Again, if you know someone or are close to someone with any sort of schizo disorder, I think that support program for is important. Dealing with those with schizophrenia is really hard. That's psychotic disorders. Again, I have personality disorders, and if you're really, really curious, then the Notion page, once more, linked in the description here, and you can go read them all. There's about 17, I think there's 15 or 16 on the page. And yeah, cluster A, cluster B, cluster C personality disorders. There's a lot of them. I didn't think there would be so much, but the most I learned while doing all of my research for all of this was in this personality disorder department. So yeah, again, one day we'll touch on that. I'll see how this episode does, and that'll probably depend on how early or late I do that. But yeah, back to a longer episode. I don't know who made it this far, and if you did make it this far, please give this a great rating, and please follow this podcast so you can listen to it every week. Hopefully you enjoyed. Hopefully you liked this. Hopefully it was informative if you came here for information. I did a lot of research, and everything I said here should be fairly medically and factually accurate, not much opinion. And if you read the Notion, things that aren't like researched will be apparent, and I'll make sure if I have an opinion that I said it's an opinion or something that I think or understand anecdotally. But yeah, Everything here should have fair facts, backing, and good sourcing. I didn't write the sources on the Notion page. Maybe I should have, I don't know, but I didn't do that. They were all so broad and they were all on similar websites. So I stuck to research papers, and I stuck to very reliable mental health organizations in America and some in the world. Yeah. Once more, thank you for listening this far. If you have gotten this far in the episode, whether you listen to hear my voice, whether you're new here just to learn about mental illnesses and disorders, thank you very much for listening. I hope that if you are new here, to see you next week. And I hope that if you're not new here, I once more hope to see you next week. Once more, back with Seriously Funny, probably a shorter episode. Yeah. Thank you for listening once again to Seriously Funny. And I will see you next week. Peace.